Thank you very much indeed for staying with us. So where we left off was that you were saying you're not a big fan or you're not in favor of what's happening in the Northwest with regards to the money that is being spent on an event like this. You're saying it can be channeled into other areas. Which other areas? Okay,
I repeat again, we don't want to be associated with that picnic that is happening in Northwest. It is not about people living with HIV. It is not about people who are vulnerable on new HIV infections. Those people are not in the stadium, are in our communities. Let's go to Northwest, in all the districts of Northwest. Let's look at the state of the clinics. So that is the first point. Issues of infrastructure. Let's ask ourselves, how many clinics of Northwest could have been improved with that 6 million? Let's look on issues of human resource.
Okay, let's look at infrastructure for one. What is your research telling you with regards to the clinics, the state of clinics in the Northwest?
The state of clinics in Northwest and elsewhere in the country, in many areas, more especially in deep rural areas, is in shambles. Clinics, our clinics, so some of the clinics in our country, you find out that they were built during the apartheid era. And then after 1994, the population in those communities increased. And you find out now the catchment area of each clinic, it's more than 10,000. According to the World Health Organization standards, each clinic must cater for a population of about 10,000 to 12,000. But when you go to our communities, you find out each clinic is catering a population of a community that is more than even 30,000. Then what does that mean? It means all the times our clinics are overcrowded. It means all the times people will have to wake up as early as 3 a.m., stand on the queue in order for them to be in the first group that is going to be attended to. When it is raining, when there is a sun, it means those people are exposed to those conditions. What does it mean in terms of dignity and human rights? So that's why we are saying, if this 6 million was not spent in that jamboree that is happening in Northwest, we could have improved the conditions of many clinics in Northwest community, but also it could have been used in terms of hiring some nurses whose posts have been frozen within the department across the country. So it could have been used on many areas to fix the healthcare system of our country that is broken.
You raise very important issues. We have a clip of the Minister of Health, Dr. Zweli Mkhize. We spoke to him early on. Let's listen to what he has to say in terms of the importance of the event. We'll come back, we'll dissect it. Stand by.
You come at a time when, in fact, the scourge is increasing from 7 million people to 8 million. Is that worrying for you?
Well, HIV as a pandemic is worrying for everyone. But what we are looking at is that we come from a long history where there was no hope. But for the past few years, a decade or so, we've been able to make a huge improvement. So we are actually happy that we have got a very strong team on the ground, working between government and civil society, motivated to go and find more people who are HIV positive and put them on treatment. And as things stand now, we're actually set to reach our target of finding 2 million more people by the end of the year. And I believe that at this point, we've got over 5.1 million people already on treatment. And so we need to fill up with the rest of the year with 1 more million. But what is good is that the 1990 target is actually getting met. Already last week we went to announce one area in KwaZulu-Natal, and this month 3 regions would have reached that target. So we will be going up the beginning of the year to find that there are about 14 more regions that are going to be achieving this target. So it's good. We've also announced a new drug, TLD, which is actually helping to suppress the disease quicker and create less complications, and we believe that's going to help us to reach the targets. So today is not just a commemoration, but it's also looking back to say how far have we gone and how far we still have to go. We're very positive and optimistic. We will defeat AIDS, but we need everybody to work hard.
Just a short one briefly, Minister. The setback, over 250 new infections annually.
Yes, that's the target now. How do we make sure that with the medication that we've got that is so effective, we do not get new infections. That's the target. It's about behavioral change. It's about people taking responsibility for their own health. It's about removing stigma. It's about making sure that everybody in South Africa tests and checks their status, because once you are positive, we give you treatment, and the treatment is actually going to help us to stop the transmission from one person to the other.
Minister, thank you so much.
You're welcome. Thank you.
Well, that is the Minister of Health, Dr. Zweli Mkhize. They are now leaving for the Orkney, where they will be visiting some of the families members who are affected by this virus. And from there, we'll give you a full coverage of what's going to happen, given that after the meeting with the activists, they will be going to the local stadium where the official program will commence. With that, back to you in studio.
All right, that was our reporter Lucas Motibedi there in conversation with the Minister of Health, and he says they have a strong team on the ground. They're on track to get a further 2 million people on treatment with regards to the 90 targets that the UN has set so for next year, 2020. He's saying that certain districts have even achieved it. What's your thoughts? You buying it?
So I need to come up front to say, in South Africa, we are no longer talking from outside the fence now. We are inside. So TAC, NAPWA, Sanarela, Positive Women's Network, Positive Action Campaign, these are the organizations of people living with HIV and AIDS in South Africa who are part of SANAC. We have entered into an MOU with the Department of Health where we said we are going to monitor 400 clinics in 8 provinces of South Africa in 27 districts. And in all these clinics, these are some of the clinics where they are providing the program of the antiretroviral and all what have you. Why are we monitoring these facilities? We are monitoring these facilities with an aim of improving the quality of HIV and TB response as well as healthcare services broadly. Because one of the things that we have identified is to say HIV and TB response, we talk about it in boardrooms, but the implementation is at facility level. If services, healthcare services, are not improving at facility level, that's where we're going to have a problem. So it is going to be our duty as well to reach out to communities, people living with HIV and AIDS, LGBTQI, people who are injecting drugs and all what have you, in terms of bringing awareness, in terms of tracing the people who have defaulted. Secondly, as TAC, we acknowledge the progress that has been made by the country. One, in terms of the introduction of the new drug, the dolutegravir, the combination of dolutegravir, tenofovir, and the other drugs. So also, South Africa is the only country that in the sub-Sahara that has introduced PrEP. As part of prevention for communities or people who are vulnerable to new HIV infections. But the question we need to ask ourselves, in terms of PrEP, how is it accessible within our communities? How is awareness being provided to our communities for those people who are accessing PrEP in order for them to adhere to PrEP as part of making sure that they won't be vulnerable to
what is the
HIV
solution
infection.
then? And just for folks to understand, when Anelis talks about PrEP, he's talking about the pre-exposure prophylaxis. So how can we make this more freely available for people who are interested in taking this?
So, one, according to our plans or within the NSP, the targets that we set there are very, 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 very low. So step number one is to increase the number of targets in terms of people who must be initiated on PrEP. Secondly, each province needs to know which facility in my province, in my district, that is providing PrEP. Thirdly, we need to reach out to our communities to educate them about PrEP and why it is important for people to adhere to PrEP when they are initiated on it, so that at the end of the day, people don't find themselves taking PrEP today and then tomorrow you don't take a PrEP, you indulge in unprotected sex, you get infected, and then you come back and you blame others. So awareness and education is very much important, but also the question of access to PrEP, it should be a priority in our agenda in terms of fight against HIV and
Right.
AIDS.
I mean, awareness is no doubt very important. Education, no doubt, is very important for the communities. But, you know, as you alluded to earlier on, you say you're monitoring these 400 clinics or so. Some of the issues that you're picking up, from what I'm getting, is in terms of healthcare professionals that are not trained enough in order to deal with people and various questions, and how, I guess, to deal with patients. You're saying that's an issue?
Yes. So all of us, we need to face realities and acknowledge where problems are. In South Africa, we've got a population of about 58 million. About 42 million of them are public healthcare users. And on the other hand, you look at South Africa's healthcare workforce, it is less than even 400,000, both in private and public. Then how do you expect a workforce of less than 400,000 to provide quality healthcare services to a population or to healthcare users who are about 42 million? Some of these healthcare workers are overburdened because in their facilities there are many frozen posts. So at the end of the day, one healthcare worker is playing too many roles, as well as their working conditions are unbearable. As the result of that, their working conditions, they are being frustrated by the system. And in that process, public healthcare users, they end up being the victims.
ripple effect.
That's where most of the times these healthcare users vent their anger. But also, it's not a justification for a healthcare worker to shout at a patient, to disclose the status of the patient in front of everybody without the consent of that person. But in some instances, as much as we fight these injustices, we need to understand as to say, what is the root cause? The root cause is that most of the posts in our clinics are frozen. And as the result of that, our nurses, our healthcare workers are overburdened.
You know, one of the other main issues is stigma. And from your research, I'm just wondering, from these 400 clinics that you're monitoring, how much of an issue is it in the area? And people are saying, Blaine, why are you bringing up stigma all the time? It is a big issue because it's preventing us from moving forward in terms of solving this crisis. What's your research telling you?
So, one of the problems that we have picked up is that because of stigma and discrimination, most of the people who are on antiretroviral treatment, they don't access ARVs in clinics which are in their own catchment area because of a fear of your status being disclosed without your consent, being discriminated, become the talk of the town. So some of the people, they prefer to go to facilities that are far from where they stay, and that's where they access these medicines. But the challenge on that, what happens if that person does not have a fare from home to that facility which is far from where they access their services? That is one of the contributing factors, and it is caused by stigma and discrimination. But also, on the other hand, we cannot dispute the fact that because of our healthcare system is broken, many people are no longer motivated to access healthcare services in some of the facilities. Let me give you a typical example of here at City Bank. There is a clinic there which is called the Zone 17 clinic. The majority of those people who stays around Zone 17 clinic, they no longer feel comfortable to access ARVs in the clinic because of staff attitude and other unbearable conditions. Some of them, they are saying to us, they prefer to take a bus, from an 8-hour bus from Johannesburg to Unu in Eastern Cape to access antiretrovirals and come back instead of being abused in these clinics. What does that mean? It means if that person does not have a bus fare after 3 months of going to Unu to collect their medicines, they will be recorded as loss on follow-up and defaulters without us understanding that what makes these people to do this, it is because of the health system that is broken. And we cannot talk about an end to AIDS in isolation of the revolution to fix the broken healthcare system. We cannot say we don't have resources. Not long ago, the former premier of Northwest and the former premier of Free State, they took the money that was meant for the AIDS conditional grant, they gave it to the Gupta-owned company, which is called the Mediosa. That was meant to provide healthcare services in Northwest and Free State for the rural people. But those services never went to the destitute communities. Here in Gauteng, the former MEC of Health, Brian Hlongwa, looted about 1.6 billion from the same public healthcare sector. So all of these inequalities and injustices, if they can be addressed adequately, it means as the country we can be able to fight the HIV in parallel with the struggle of fixing the broken healthcare system and get rid of all these politicians who are corrupt.
Look, no doubt we need to test some of the allegations that you're mentioning.
Yes.
But you are saying generally corruption also plays a huge part in terms of access to medication. Yes. Alleged corruption in this regard.
Yes, there is a corruption within the healthcare system, and one way or another, when the money that is designed or dedicated to do this is not spent on this, is redirected to do something else, that is part of corruption. Because when we're talking about corruption, we need to think about two things. One, corruption is about breaking or violating the laws, knowing it very well that what I'm doing is against the law. That is part of corruption. And two, it's about stealing from the public purse. So there are many instances where wrong decisions have been taken, and these decisions that were taken impacts on the quality of healthcare services. And if we don't have adequate healthcare services, it means our fight to combat the spread of HIV and tuberculosis won't be effective. But on the other hand, we cannot turn a blind eye to some of the pharmaceutical companies who are making profit out of the lives of the majority of the poor people, more especially people living with HIV and TB. Because there are some pharmaceutical companies who are still charging too expensive medicines, which makes it difficult for poor people to be able to have access to affordable, effective and quality medicines.
So let's talk about one of the drugs that's on the market, which is TLD. You say you welcome the rollout of TLD, and it's far cheaper, and I guess less side effects, although there are some. But you welcome it generally.
We welcome it generally. Having it on within the public healthcare system, it means that many people who are living with HIV and who are on ARVs, they will no longer take ARVs that have a lot of side effects, because it is said that there are lesser side effects on TLD. But also the other question that we need to ask is around the accessibility.
Yeah.
It has been launched. How many facilities in the country that will start rolling it out, per province, per district, per facility, so that we can be able to send a clear message to our communities as to say, if you want to access it, go to this facility. So these are some of the things that we need also to address.
You know, some of the big pharmaceutical companies will argue that it is their prerogative, I guess, to make profit. They're a business. But I guess they're producing certain of these drugs like the TLD that is helping our communities. But now the next issue is accessibility, you say.
Yes.
Yeah.
So if we may recall, in 1995 in Doha, there was a conference which was organized by the World Trade Organization, where among other things which was discussed there was around TRIPS, the trade-related intellectual aspects of property rights. In that conference, there were decisions that were taken around TRIPS flexibilities. A decision was taken that in countries where there are cases of health emergency, TRIPS flexibilities should be applied. And these TRIPS flexibilities includes number of issues like your parallel importation, your compulsory licensing, usage of generic drugs. So it can't be true that whilst we still have TRIPS flexibilities, these pharmaceutical companies continue to overlook the TRIPS flexibilities and put profit before the lives of the people. If health is a fundamental human right, it means these pharmaceutical companies must forget about the profit and think about saving the lives of the people.
We have talked a lot about some of the challenges that faces South Africans in making a dent in this fight against HIV and AIDS. What are some of the notable achievements, though, that we've made?
Some of the notable achievements that we have made in South Africa, I can say for the first time in our history, organizations of people living with HIV and AIDS in South Africa, they work together. NAPWA, TAC, Positive Women's Network, Sanarela, Positive Action Campaign, which gives hope because the unity of the people living with HIV and AIDS, it means that it is the unity of the ordinary citizens on the ground, because all these organizations are membership-based organizations. Meaning, two, the understanding we have with the Department of Health that we will monitor these facilities, we will work together in terms of identifying problem, engaging with duty bearers, assist in tracing the defaulters is one achievement. The fact that in South Africa we've got about 5 million people on ARV treatment is an achievement, because anywhere in the world there is no other country that has this highest number of people on ARVs. The fact that we are about at 87% of the first 90 of the 390s, it's an achievement. The fact that in November we have introduced as the country idolutegravir is an achievement. The fact that South Africa is the first country to provide the PrEP is an achievement. However, all these achievements do not define an end to a fight against HIV and AIDS. They define a step forward to the right direction. However, if we as civil society, we will forget about our role, as to say our role is not to rub shoulders with government or politicians, but our role is to be the mouthpiece, the voice of the voiceless people, so that we can be able to be constant reminders and the watchdogs of the majority of the people in terms of when politicians are messing up with our lives, we must be able to stand up and say no.
I guess that's very, very important. In order to keep the balance, you need this grassroots, a swell of grassroots activism, one would say, to keep government on their toes. I mean, we domestically funded, 80% in terms of our programs here, with about 20% coming from the likes of PEPFAR and stuff like that. I want to talk to you about donor funding with regards to the fight against HIV/AIDS. But I want to remind our viewers as well. I mean, this year's theme for World AIDS Day is communities making a difference. Like we were talking with Anele. Cheka Mpilo. Now, the South African AIDS Council has urged people to check their status. Let's take a look at this report by Lucas Motipedi.
South Africa carries the biggest burden in the world of HIV and AIDS. We have made a lot of progress. In actual fact, South Africa is amongst a very few countries who are said to be beginning to run in terms of ending the HIV/AIDS epidemic and actually working out programs for the response.
In fact, I was just about to ask you that, given that the stats show us that 90% of the people in the country who are living with HIV and AIDS know their statuses, but that essentially means that 10% of the people that may have this virus do not really know their status. Is that a concern to you?
It is a serious concern. That's why we are making a call to communities to make sure that those people who don't know their status actually go and screen. Our theme is communities make a difference. Cheka Impilo. It means that people must go and screen and know their status for HIV and be put on treatment. Because when they are on treatment, we know that it is difficult for them to transmit the virus, and hence the new infections can actually be kept radically.
And what are the new trends of this, the scourge, the new infections? We understand about 250 people annually contract the virus. Have you managed to assess the new trends or the determinants of the spread of this virus?
The new infections, I think I need to be able to clarify to the nation, have actually gone down. Because sometimes when we hear reports, they're saying that the infections are increasing. They have gone down. But I'm sure you agree with me that 250 is it's a lot. No, they've not gone down fast enough, radically enough. We need to accelerate that curve so that it can bend very, very fast enough. There are a number of areas that are being reported. For instance, people are being very complacent about prevention packages that are taking. They are not preventing, they are not protecting themselves. The condom use is being impacted upon. The actual knowledge on HIV and AIDS in South Africa is actually going down. So we need to step step up the campaign and make sure that communities take up this particular effort to end the epidemic once and for all.
So stepping up the campaign and communities getting more involved, it's something that I was talking to my guest that's sitting next to me, Anele Yawa from the TAC. I want to take you now to the Northwest where the national commemoration of World AIDS Day is happening. And I understand that we're hearing some personal stories of people infected and affected by HIV and AIDS.
Because when we come back to the civil society, we need to come back. What am I bringing to our people? What am I bringing to the clinics? Pamphlet. I don't want to bring pamphlets. I'm an activist. I don't want to bring pamphlets to say I was at that meeting. I always fight for batho ba re batlelang mo community re batlela ka eng in order for them le bone to finally believe in the finding the cure of HIV or living longer with the disease. I thank you very much. Ke fellwa ke moya.
Please stand up for hands, clap hands. Let's give a round of applause. Round of applause.
Millicent. Yeah. She's inside here. Call her.
Can we get Millicent in stage?
Millicent.
Can we get Millicent on stage?
Come on stage. Okay. Oh, c'est l'MIC for social development.
Who said? She's behind.
MEC for social development in the house.
You can use this one to pay. You can use this one.
Yeah.
Thank you very much. We can take our seats. Well, these two ladies, why I'm standing up, I visited the house. I visited them. There were two. And I made a commitment when I met the two of them. So Millicent is not here. Can I request Millicent?
She's with MEC for social development and SABC outside there.
Okay. But there were two living with HIV and AIDS. And when we spoke, well, a young child, come, there's the child.
And his daughter.
Her daughter, there's the child. Come this side. Then she said to me, I've got a request to make to you. I'm told you are being called Deputy President, so I've got a request to make. And the request is that you must find my mom a job. And you must build my mom a house. Well, I decided today, because her mom, she's living with HIV and AIDS.
Let them come. Let them come.
She's going to be employed in our office. She's going to go out there and tell our people that they must go out and test, they must know their status. She will go out there and tell our people to take their treatment and stay on treatment. So she's employed from today. And Millicent, she's employed also. Because in our approach, we must be practical. You can hear that when they talk with passion. And these are the messages that we want to hear. So, I'm not going to renege on this promise. The house and your employment. Mom will be strong, and I agree with all of you that we will overcome. Thank you very much.
Now, you can lead the children, and please take care. Yeah. Round of applause. A round of applause. I recognize that we have the chair of the AIDS conference 2019, Professor Mafuya. Can you stand up? And we are joined by people who are leading the visits. The Deputy Minister of Social Development is here. Deputy Minister. My colleagues, MEC, who were not here when I introduced others, please stand. You were in the visits. Kihakilwe and Tlapi. Thank you very much. Can we now call on stage civil society SANAC, led by the SANAC Deputy Chair, who's co-chair of SANAC, Ms. Steve Litzike. Clap hands.